Hello, my name is Dr. Alistair Diaz. I'm a lecturer currently at the University of Toronto in the Human Biology program. And we're here today to sort of give you an idea about some of the things that myself and Dr. Cook here do at the university with regards to complementary and alternative medicine. Just to initially introduce myself, I have a PhD in biological chemistry, so my background isn't directly biology, but biochemistry. And when I came to the biology program, I was able to sort of expand my knowledge base and teach various different courses, spanning everything from neuroscience, human physiology, gene genetics, biotechnology, health and disease. And I was actually a little bit apprehensive when I got assigned some other courses, including complementary alternative medicine, which I didn't have great knowledge or a lot of knowledge about initially. So I took it on as a challenge, and I took it on as something that I wanted to learn to teach. And both myself and Dr. Cook, to be honest, Dr. Cook I look at as a role model in some ways, and sort of a walking book of knowledge. And he's been sort of the go-to guy for me in terms of helping to get the information across to the students that we teach. Tim?
Thanks, Al. So, Tim Cook, I'm an internal medicine specialist by training, and along the way encountered lots and lots of patients who had developed chronic illnesses that were frankly not being very well managed by Western or so-called allopathic medical doctors. And many of them were seeking care on their own from complementary alternative medicine practitioners. And increasingly, as I got interested in some of these other practices and began to understand some of the worldview and the health, the long history of some of these practices, I came to realize that perhaps the way forward for medicine is to actually integrate the best of alternative complementary practices, especially those that are increasingly evidence-based, with allopathic Western medicine.
And why not, right?
It only makes sense. It's the best thing for a patient to be able to have the best care. And if the best care comes from perhaps, like you might get in the building we're in right now, traditional Chinese medicine, acupuncture, very good for chronic pain, for example. But that doesn't mean they can't also take pain medications. And the combination of the two might work synergistically. And increasingly there's evidence that this is the case. But at least in Canada, it's very difficult to find places where you can, under one roof, have an integrated health experience like that. And so that's something that I am aspiring to achieve at some time. In the meantime, inquiring minds like to know, and the University of Toronto students, fourth-year biology students that have partaken of the complementary alternative and integrative health course that we co-direct, I think have had potentially some life-changing, transformative moments. Many of them, of course, are medical doctor wannabes.
Doctors, yes.
And some of them have said, you know what, actually maybe I should explore the option of naturopathy or chiropractic or traditional Chinese medicine. And I think what I've found and what the students have expressed has been the most interesting thing about the course is the experiential aspect. It's not just a bunch of these practitioners standing up and giving didactic lectures. It's actually hands-on experiences of many of the things that we talk about. And my area of interest is mind-body medicine, so they get an opportunity to practice meditation.
An opportunity to practice yoga.
Yoga, the Ayurvedic day we have with a specialist. We've given them experiences of biofeedback tools, some of which I have here to show. And so for the first time this year, the course has run now for 7 years, each year getting, I think, more positive response, both from students and from faculty. But for the first time ever, we're having a conference.
Yes.
This was Dr. Diaz's brainchild, so take it away, Al.
Well, what I really want, the message or the main theme this year I really wanted to get across was integrated health. And as we mentioned before, if you want to strictly define integrated health, it's the combination in an intelligent or well-researched way of bringing together CAM treatments, complementary alternative medicine, and conventional allopathic medicine, to give a patient the most effective treatment out there. And like we said, why not let them make the most informed decision they can with what is available to help them. And when we start thinking about alternative practices and conventional medicine together, there is a barrier there. There's a barrier between Western practitioners and holistic practitioners in terms of how to bring these two worlds together. And we really need to work on figuring out how to be able to do that. And so this conference is there, one, to inform those at U of T, not only those at U of T, but it's also open to the public, to come and see what alternative practices are about, how they are analyzed, like I said before, and then at the same time to show how they could be integrated with Western practices if the evidence that is presented is sound and makes sense.
So we've asked the students to come up with posters that reflect a review of the literature or research or a question or a case, a clinical case, that brings to bear integrative health. And I'm really looking forward to seeing these posters.
I am too. So we have students picking a particular CAM therapy in addition to a particular condition. So we give you an example. Let's say the use of yoga to help autistic children. Are there any positive effects on these children when they undertake yoga or take part in yoga stretches? For instance, probiotics for irritable bowel syndrome or gastrointestinal problems. So there are a variety of different topics in CAM therapies that you can choose from, but they're going to look at these things more in depth and look at the literature, present what the literature shows, and then analyze it from their own eyes. Is it positive? Is it negative? And can it be integrated with Western therapies in some way? So, like Dr. Cook said, I'm also very interested in seeing what the students come up with, and also the reactions of people who come and see these posters to see what they think about these therapies once presented. So the poster session is one aspect of this conference, which our students are directly partaking in. However, we have multiple other elements, including a very important keynote talk by Dr. Cook here, trying to bridge the gap between, I would say, hard science and CAM, which is, I'm not trying to put CAM at a disadvantage, but we need to, like I said, in order to bring the two worlds together, I think we need to come from a hard science perspective. And Dr. Cook's keynote lecture is hopefully going to bridge that gap.
I'm going to start and review a little bit of our history of appreciation of material world, spiritual world, various world views of health, what leads to health. And our sort of reductionist, materialist approach to medicine has a fairly recent history. From Koch's postulates forwards, we're talking less than a couple hundred years, whereas many of these alternative, complementary, or traditional health practices go back 3,000 and 4,000 years, and in particular the mind-body piece I would like to bring up as something that's now very compelling for good health, and there's lots of evidence. And again, from the genome to mindfulness and everything in between, I think integrative health is really ultimately the way forward for understanding our humanness. Mm-hmm. There will also be, in keeping with the experiential side of it, there will be an opportunity for workshops around, again, some mindfulness, meditation, some of the biofeedback tools, HeartMath, which is heart rate variability.
And we're hoping some of these, this mind-body workshop may actually be beneficial to some students in terms of helping to induce their relaxation response and perhaps reduce some of their stress levels. It is exam time after all, and so, like I said, some of these techniques that we'll be going over and how to sort of read your own body and understand what your body's telling you, I think is very important. And if you understand some of these techniques and how to use them, they could be beneficial to you.
So when is it?
So the conference is taking place November 27th, Tuesday, November 27th, in the MSB lobby. The registration desk will be in the MSB lobby. It's actually 2 locations. The conference is actually sponsored by the Human Biology program in addition to New College. So the keynote lecture by Dr. Cook will be taking place in the William Dew Auditorium, which is part of New College, while the poster session will be taking place in the Medical Science Building, hopefully to, like I said, expose some of the medical students there to some of the cannabis practices that we'll be talking about, because they do get very minimal exposure to the subject material. One of the other components that is part of the conference will be a special booth session. And what we're aiming to have set up are a variety of different booths for a variety of different CAN practitioners and other specialists to talk about some of their sort of practical experience. What is it like for a naturopath to be in the clinic? Dr. John Dempster, who's one of our guest lecturers, will be there representing his specific clinic, his integrated clinic here in downtown Toronto, along with CCNM, the Canadian College for Naturopathic Medicine, to give students perhaps an opportunity to look for career opportunities. If they do have an interest in alternative medicine, how do they pursue that, and what are the steps we need to take to get there? In addition, we have Dr. Mary Wu from the Toronto Chinese School of Medicine, who will be a representative at one of the booths as well, also talking about if a student is interested in the pursuit of becoming a traditional Chinese medicine practitioner. And she'll also be displaying some of her diagnostic techniques, tongue pulse diagnosis, which will be very interesting to see. In addition, we have a chiropractic representative, Dr. Adam Bledsoe will be there. Perhaps he can do a little bit more than fix someone's back and tell you a little bit more about what chiropractic is about. We have a special booth on concussions and CAN therapies. Concussions is a big topic in the media these days, especially among athletes. And can complementary alternative medicine be used to help with concussion patients, which would be an interesting group to check out. I think we have a couple more that should spark some interest, and I encourage you guys to encourage everyone to come out and interact with the participants at these booths and ask questions, be inquisitive, and see where it leads you, and perhaps you'll be able to network and find an opportunity in complementary and alternative medicine somewhere down the line.
So how does one register for this?
So in order to register for the conference, we have 2 major ways. You can go to our Facebook site, which has a Google survey link. It's a survey that will take you less than 2 minutes to complete, but once you complete the survey, you are officially registered for the conference. I should note that just by clicking join on our Facebook page does not register you for the conference. In addition, once you are registered through the Google survey link, you are asked to check in at the registration desk the day of the conference in order to pick up any required materials, including a program for the day and just a map of where you want to be or where you want to go for the day's events. Oh, and please shout us out on Twitter, at U of T CAN. Make sure you guys post a message, spread the word, and spread the excitement about the conference.
Best of all, it's free.
It's free, yes.
And there's free food.
It's open, free, come for the food, but most of all, come for the knowledge. Thank you.
Feed your mind.